The future of surgery isn't just about technology, it's about the experts who drive it forward. At St. Luke's, these experts redefine gynecologic care.
I'm Dr. Camille Ann Abaya. I'm an obstetrician gynecologist with a specialization in minimally invasive gynecologic surgery and robotic surgery. I've been doing robotic surgery since 2011, so I've been in the practice for 14 years.
I'm Elizabeth Joanne Esguerra Ocampo. I am a minimally invasive gynecologic surgeon trained in robotic surgery, and I'm practicing in St. Luke's Medical Center, Global City for 14 years.
So hi, I'm Dr. Marie Victoria Cruz Xavier, obstetrician gynecologist, minimally invasive gynecologic and robotic surgery expert. I've been practicing at St. Luke's Medical Center, Global City and Quezon City. I have 14 years of robotic GYN practice.
Hi, I'm Dr. Elsie B. Pasqua, and I'm an OBGYN, and I am a minimally invasive surgeon and robotic surgeon, and I'm practicing here at St. Luke's Global City and St. Luke's Quezon City. I've been practicing robotic surgery for 14 years already.
With the power of robotic surgery technology, procedures become more precise, recovery times shorter, and patient outcomes better.
So robotic GYN surgery is a small incision surgery, or what we call minimally invasive gynecologic surgery. So this allows us to do simple and complex gynecologic procedures, which is normally being done via open surgery.
Robotic surgery is an enhancement of your laparoscopic surgery. It provides you with 7 degrees of freedom. The 3 degrees provided by the robot arm, the insertion, the pitch, and the yaw. And the twisted instruments provides you with 4 degrees of motion. It allows you to grip the pitch, the yaw, and then you roll. So this improves your dexterity. It allows the surgeon to manipulate tissues and dissect tissues in a very delicate and controlled fashion.
The advantages, because it has smaller incisions, definitely there's less pain, there's less blood loss, and because there's less pain, there's also faster recovery. Aside, of course, from aesthetically, you have very small scars that are hardly seen. All the women's diseases can actually be treated with robotic surgery, or almost all, except the advanced cancers. Okay, so you can do robotic surgery for myomas, for adenomyosis, for abnormal bleeding, for ovarian tumors, even for cervical pathology, as long as it's early stage.
So we use the robot system here in St. Luke's. We use the Vinci. And the robot system is just the tool, okay? But the one who operates, the surgeon, is the one who is in full control of everything. So we love it because of the features, like for example, the 3D, the three-dimensional camera, so clearer visualization. And because of the very high technology instrumentation, we can come up with a better surgery because of its accuracy and precision.
The robotic platform allows multiple surgeries, all robotic surgery in one go.
Before, it would need to take like 5 days, 6 days before you get discharged with open surgery. For now, you can actually send home on the same day or even the next day. Well, I think first of all, if you're scared, do your research.
Detection gives superior outcomes in terms of prognosis of diseases. So for us to be able to, take care of our loved ones, it's also important that you take care of yourself.
Even if you don't feel anything, I encourage all our mothers, all the women, to be seeing their gynecologists, well, at least once a year for their annual women's health care. So if you do that, you could be able to detect some problems, and then the proper treatment could be given the soonest possible time. I would say that mothers, women, are the best multitasker. We juggle from one job to another as a loving wife, caring and loving our children, to an empowered career women.
At St. Luke's Medical Center, we see the shift from conventional surgery to minimally invasive and robotic surgery.
Because of the good instrumentation, we can do complex procedures through this robotic surgery. You could be able to dissect, safely delicate tissue. You can suture even to the deepest portion of the where the lesion is. So I would say even the complex procedure or the difficult procedure, you can do this with robotic surgery.
The robotic surgery overcome the limitations of the laparoscopic surgery. In any surgical specialty, vision and knowledge of anatomy is very important. So now, we can do things we cannot do with the laparoscope and the power in the operative field. And clarity of the structures, because you can use ultrasound-guided intraoperative ultrasound, which can enhance your vision. So things you cannot see with your eye, underlying structures are seen using the ultrasound probe, and then you can do it simultaneous with your surgery. So you have the TilePro app, you can see the actual view, and then you have the ultrasound view in one screen.
In this way, we are able to really zoom in and really pinpoint the lesion or the problem with the patient. No? So with the robotic platform, the surgeon is actually more precise in their movements. No? So with difficult or complex surgeries like endometriosis or cancers where we need to really dissect extensively,
you have this connection with your patient, with their family. It's not just in the OR, not just from cutting to closing. The connection is formed before the surgery. And then after the surgery, that bond continues. And then even after they get discharged, sometimes that bond, the connection remains for years.
Robot seems or sound to be so dense and so heartless. With robotic surgery, but the heart and the pulse of the robotic system is still the surgeon.
Don't be afraid. Come over, explore your options, see one of our robotic surgeon doctors, and they will definitely be able to explain to you what the robotic platform is in depth and very particularly to your case.
It also matters that you go to the right experts or the facility which can offer such option. At St. Luke's Medical Center, we have 14 years of experience in robotic gynecologic surgery. We have done several thousands of cases here in our center.
Are equipped with the state-of-the-art technology. At the same time, we have the experience, the knowledge, the good patient outcomes, the numbers of surgeries of our experienced doctors in different specialties.
We have all the experts that you need under one roof.
It's very crucial. The number of cases you've done adds to your proficiency. All the mentors and proctors are housed in St. Luke's Medical Center.
Not many people know about robotic surgery. And so if you just do your research, then you will know that this is available for you. And I think you wouldn't be so afraid to undergo women's procedures or treat your women's disease. So come over, the doctors can explain to you, and hopefully it would allay your fear.
Needless to say, the heart of robotic surgery is right here in our home, St. Luke's Medical Center.
Behind every precise movement is a purpose. Behind every healing is a team committed to helping women rise, recover, and reclaim life. Choose precision. Experience the power of robotic-assisted gynecologic surgery at St. Luke's. Choose faster recovery. Get back to life sooner with minimally invasive care. Choose expert hands, where technology meets world-class gynecologic specialists. Trust St. Luke's for advanced, compassionate women's health solutions. Because the right choice is right here.